Welcome to the Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. In today's episode, we're diving into something that makes a lot of healthcare teams squirm, the CAHPS survey. You'll hear a refreshingly honest conversation between Dr. Rhiannon Winsor, Kimberly Gonzalez, and Sam Reinhard as they break down the real value behind patient feedback, from what those numbers actually mean to the simple changes that can make a big impact. Is your team overlooking golden insights in patient surveys? Stick around, because this episode might just change the way you look at patient satisfaction scores forever.
So joining me today is Kimberly Gonzalez, our Manager of Population Health Analytics and Community Health Outreach. And we're thrilled to welcome Sam Reinhard, Director of Community Outreach at Sun Life. Thank you, ladies, for being here with us today. Sam, before we jump in, can you tell us a little bit about yourself and your role at Sun Life?
Sure. I am the Director of Community Outreach. I've worked for Sun Life Health for 14 years, so I like to say I started when I was 12, and I grew up there. My role, I have grown over the years, of course. I started out marketing side, and then through that, really started trying to match how what we market matches the patient experience, and then started absorbing a little more patient experience roles. So I do administer our patient feedback surveys. No one likes to talk about this, but I love taking patient complaints because you get a lot of feedback in that. And there's a lot of improvements we can make through the little nuggets we hear from people, not typed out from people. And then I oversee our contact center, which is full of knowledge. So I do have my hands in quite a few different things. And then, of course, building community outreach, advocacy, and really trying to figure out what's happening within our communities.
Well, welcome. I think that's a good segue into what we're talking about in this episode, which is the CAHPS survey and patient satisfaction. So to start off, can you help us understand what the CAHPS survey is, what it measures, and why it matters to FQHCs?
Yeah, I'll take this one if you want.
Go for it.
So the CAHPS stands for the Consumer Assessment of Healthcare Providers and Systems. Lengthy way of saying it is a patient experience survey. And so a lot of the questions will ask the patient specifically of how the care delivery system works and whether it met the expectations of their visit. And so a lot of the times I think of it as a good way to pulse check. Are you actually meeting the patient and where they want and what they need? And a lot of the times you'll hear questions like, did your provider communicate to you in a timely manner? Did you understand? Was there any questions that you had and were they answered? Were resources provided? And so it has an array of areas that it covers, certain ones being access to care, provider communication, and care coordination. And so it's always good to kind of use these as a pulse check and knowing where you need to improve over specific areas.
Excellent. Thank you, Sam. Anything to add to that?
I think CAHPS is just a known survey administered across the healthcare spectrum. So it's a good tool to identify and benchmark how you're maybe doing compared to other agencies. It's a good tool to use from an external partner. Of course, we all do a lot of our own patient experience surveying and those kind of things. And so I think CAHPS is usually done by a third party, right? So it's completely separate, and I think you get a different perspective than whenever you're sending the survey out yourself. And so it's an additional tool to measure how people are providing healthcare across the country.
And I think one nice thing about that with it being from a third-party vendor is there is a standardization to it, and there is a very cut and dry technique to how they outreach to the beneficiary. So it's nice to see whether your patients will recognize your name and whether they'll be willing to participate, because I think that's also a very big telltale on what engagement you have with your beneficiaries and whether or not there's that stickiness to it.
Good point. So do you think that most clinics actually take the CAHPS survey results seriously, or is it something that they just look at once and put it on the shelf and they don't think about it again? What do you guys think?
I think it's a double-edged sword, so it depends on the agency probably. However, historically, most health centers, right, we're talking FQHCs, they're not administering CAHPS surveys, right, because there's not really been the requirement to do so. However, the health plans are doing them if you're on Medicare, right? And so we work closely with them. And so they've always given us this data about our patients, their consumers. The disconnect sometimes lies within the health center. You're getting it from all these different parties and how you did. So absorbing all of that data to be like, I did really well over here, but this one thinks I was terrible, right? And then trying to find a happy medium in there is difficult when you're trying to just absorb the data, right? Mm-hmm. So then naturally, you're going to just resort to the data you know and the one you administer, right? This is how I feel. Of course, I said I've been doing this for a while, so I think we started there. So I feel like I'm speaking a little from experience, but at the same time, we attend a lot of meetings, and so you can kind of gather the feedback. A lot of people have not paid too much attention to it. I think all data is good data, whether it's skewed or not skewed, or it's a small glimpse. It's still a nugget you should have and keep as a piece of like what you're considering whenever you're thinking about your plans. Even if it was just with one health plan, it's still the perception of those members, right? And so whenever we look at some of the data, I think whether it's you can make sense of it or not, if they thought you were running way behind, let's just talk about wait times, right? If they had the perception of that, but this other one didn't, how could you change their mind, right? It's still someone you're dropping the ball on, at least perception-wise, right? And so how can we improve those pieces is important. And then the other piece of it, if they're saying this and our data's showing another, why, right? And then you know it came from this specific health plan. So how many of those members? Is it a particular office? I think a lot of times their data helps you drive more actionables to them to ask more questions. And I don't know that everyone looks at it that way because we get a lot of data. Mm-hmm. And so it's really difficult to sift through.
Yeah, jumping in on that, one of the biggest things I've always said, and I talk about it anytime we're talking with our data team, is you have to kind of treat these surveys almost not as a reporting tool, but more as a listening tool. Where are the gaps? And there's always obvious sections where you see that year to year there's no improvement being made. Mm-hmm. And so that tells you very specifically, is it a workflow issue? Is it a provider issue? Is there something going on at specific clinics? But to that point, there is one thing that, is the downfall of the CAHPS is that it is an ACO requirement. And so like Sam said, it's really at the health plan or ACO level, and so you don't really get that specificity of which satellite location it is or which health center in particular. But the nice part is if it's let's say going back to wait times, that's a specific area, you can then look internally to see, okay, what communications do we need to have with our operations team, our clinical team, and where can we improve it? Because either way, if it's not really, one specific location that you can corner in on, you can at least look internally. Okay, are we also seeing this with our internal surveys? Has there been complaints about this? What is the patient experience journey like, and how can we improve it to hopefully see a bump? Because there is also the financial incentives tied to the CAHPS, which is, I think, one of the biggest motivators for some of our health centers is those 1-point adjustments do reflect in yearly savings that we get from MSSP. And so that's also a nice another little push to hopefully make this be more of a internal discussion, and help that happen within our health centers.
I think the other piece of it is if you're not having the discussions, you will never improve. And so the more you're talking about how can we reduce wait times, or why is this their perception, what could we do differently, they're not always a big shift, but if you're not talking about it at all, there is going to be zero movement, right? And so the more you talk about it, the more your teams really start talking about it or thinking this is important. And if you just sat on it, thanks so much for your info, move right along, it doesn't go anywhere, right?
And that proactive approach is really what's key to make these, useful and actually insightful. Because if not, if you just look at the scores and notice that there's a deficit in a specific area and there hasn't been improvement, this survey gets administered yearly. And so if the longer it takes for you to act on it, the more months you're missing to improve that. And so that's when you see certain things kind of remain stagnant, and it's because of the lack of internal conversations. And there's only so much that can be done on the ACO side to drive those, because a lot of the times there are internal workflows and discussions that have to be had amongst that health center's staff.
Good point. So I think that we're kind of already dipping into this. You talked about the potential varying results of the survey. Are there any other misconceptions that you have observed or in your experience seen with the CAHPS survey?
I think largely over the years, as much as we know we have to pay attention to this because of the ACO component now, right? We've all been having to look at this data. If you're getting such a low response rate, because historically it's had a lower response rate, people tend to pay less attention to it because it's just a few people, right? When you look at the overall day-to-day operations that you're managing, right? Mm-hmm. If we have 50,000 patients, 170,000 visits a year, plus every other touch point there, right? And you're only getting this one little snapshot from a few people, ultimately, you're not really going to buy into it, right? Because it's a few squabbles, maybe. But I think feedback's feedback, and you got to get it where you can, especially knowing a lot of people don't love taking surveys. So I think a lot of people have dismissed them because of that, because generally speaking, it's a low return rate when you think of the volume, right? Now, I think some organizations are paying a little more attention, right, because of the shifts in ACOs and those measures. But I think you should always be aware that it does impact like your star ratings, right? And whether it has a financial component or not, we live in a transparent world, and it's only becoming more and more transparent. And I think the perception, whether it's of the organization or the provider on an individual level, you don't want your perception to look poor, right? And so you have to pay attention to what people are saying so that you can figure out ways to turn it around for them. Whether their wait time stays the same or not, but you filled it so it didn't feel like there was this long wait time, right? Yeah. Or you had a really great way of making them feel extra special when they were there, so they didn't really care about that wait time because they think, oh my gosh, that was so personalized to me. I think sometimes it just gets your wheels turning about how could I have improved that. I like to say if one person said it, there's probably 10 others thinking it, and you have to think of it that way and maximize the number. The volume has to increase. They're generally not just one-offs.
Yeah, and I love that you said that, because one thing I think that we've commonly seen, just speaking with our CAHPS scores specifically, is we've had probably about 250 responses when our ACO as a whole is around 5,000, 6,000 beneficiaries. And so it is important to note, those individuals who do take the time out to respond, it's about a 50-question survey. It's long. And so just the fact that they responded tells you they care enough to want to have their voice heard. And so that's where you have to say, okay, well, what are they telling me with their responses? And sometimes it's simple actions, like you said, Sam. I think one of the things, for example, with stewardship of resources, sometimes it's just the lack of not knowing that things are available. A lot of our health centers have transportation. They have sliding scales for pharmaceuticals. There's all these different programs that patients just aren't aware of. And sometimes it's a simple CHW outreach or a website blurb that says, here's our one-pager, call this line if you want more information. Just that is enough sometimes to make the beneficiary feel like there is resources available at their disposal, and that it will entirely shift the experience. And in turn, they'll say, okay, this is my health center, and they're the ones that care about my care, and they are the ones who are going to see me for the longevity of it. And there's that stickiness and that member retention, which ties back to what our entire mission is. And so I think that's part of the focus, is you can't really look at the number and say, oh, that's only about 10% of our population or whatever the number may be. You have to look at behind it. Those are 250 people who are willing to tell me their story because they want to see a change happen.
Or they loved you, right? And they want to see it continue. Mm-hmm. And that's the other piece of it, right? They're still your members giving you info. And that's who we work for, right? Obviously, I said I oversee our marketing, right? And it's still the number one way people choose your health center is word of mouth, right? Like I could do an ad anywhere all day long, right? But it always comes down to the care you're providing. And so if I can't convince those members to tell their friends, family, or neighbors where they go, then we're not doing our job right, right? And so there's always someone else waiting to see your patient, waiting and ready.
Yep.
And exactly. I think that's one thing that truly we've had a negative tone about, CAHPS score and how low scores can impact us, but there is the good scores, and you need to know, okay, what does that tell me that I'm doing right, and is this going to help me attract more patients? Because one of the areas we score really highly on is patient education, and I think the reason why that's so is because there has been an expansion in care management and the services offered, and I think there's even new ones where we have e-learning available for patients. There's different pamphlets where it's one-on-one with CHWs or care managers, and you really feel like you have a whole care team behind you. And I think when you have that, like Sam said, word of mouth. You'll be able to get the neighbors, the friends, and expand your network, and eventually you build a community within your community. And that, I think, really helps back the confidence in your health center and our ACO as a whole.
Yeah. Case in point, I was talking with my dad because I recently relocated, and I'm like, I need to get a new primary care provider. And he's like, well, don't go to, this is where I go. And he was very vocal about telling me why I should not go to, this one specific place. So I think, it's that age old, when we have a negative experience, we tell 10 times more people than when we have that positive experience. So that sounds like one mistake that health centers could possibly make. Just to wrap up this episode, can you think of any other common mistakes that health centers make regarding, reviewing the CAHPS results?
So we don't administer CAHPS survey, but we have a pretty lengthy survey. Those questions are pretty specific so that whenever we do receive this data, we have a like for like question. It's not the exact question, right? But it's consistent. And so when you see something that's in that same bucket, you want to really see what is happening. Where are we dropping the ball? Because when you're managing multiple health centers, right? When you're looking at the whole, the picture isn't the same as when you drill down. And then sometimes it's not drilled down like that per that provider. So the tactic could be very different. And so I think the common mistake is just looking at it as the whole network instead of trying to figure out how could we drill down within your own sub pocket. And I think that falls short because we all aim for consistency. Yeah. Right? And so recognizing we're not all the same. We're all humans. Providers are no different. The front office staff are no different, right? Like everyone's their own. And so their tactic, their way of doing something is still their own. The process, we try to make them standard as possible. But sometimes that's just not going to work for this one provider, right? So how could you maybe get in to help them and shift their perception to really push the needle a different direction within your perception surveys? Knowing if you look at it on your bite-sized chunked way, right, like we're doing them daily, right? They're based on the visit. If you know which ones really tie into the CAHPS, then we know where we can probably put our impact, where it matters, even though it's once a year, right? It's a constant conversation of where you can improve. It's constantly looking at those things. And I think we, as healthcare, we get caught in trying to do stuff that are gaps or, right, not just the perception side of it. Like we know our stuff. Patients don't know our stuff. And so it's the education of it generally is what gets lost because healthcare is hard. Navigating it's difficult. And we're expecting people to really just understand it. And that's usually where your perception lies, is a lack of understanding or a lack of communication, not because you didn't actually give them their lab results, not because you didn't place the referral, not because you didn't see them. All of those things happened. It's usually just a perception component based on the patient communication or the education that we take for granted.
And I think that's one of the opportunities that lies in both the CAHPS and in any internal surveys you do, where you can really see, if I put myself in the shoes of our beneficiaries, what are they experiencing and how can I improve it? Sometimes it's a simple script change for your outreach center when they're calling out. First, instead of just starting hey, this is your reminder about your upcoming appointment, a quick just, hey, how are you? Pulse check. That little change right there will make all the difference for the beneficiary. And I think that's one of the key things where, yes, the CAHPS survey is administered once a year and it's really as a network population whole, but there's internal surveys that you have that mimic that same, questionnaires and categories that the CAHPS does, where you can check and see, okay, if CAHPS tells me that I'm performing low here and I've noticed a spike in a couple complaints or, low scoring areas within our internal surveys, what does that tell me as a whole and what can we do to improve that? And I think that proactiveness is really the missed opportunity a lot of the times with these surveys.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.